Theories that are used in nursing research were not discovered but created by nurse researchers to define our profession. They are established on observable evidence and creativity. There are multiple types of theories, concepts, and models, but the one that seems the most appealing are the middle range theories. Middle range theories focus on more specific phenomena and help to describe and characterize the nursing process. Of the different types of middle range theories, Michel's uncertainty and illness theory stuck out the most to me. Michel's uncertainty and illness theory can be used to focus on the concepts of uncertainty or a person's inability to determine the meaning of illness-related events. This theory has taken the experiences of illness and treatment and measured how uncertainty with results will make people adaptable to situations. Meta-paradigm concepts comprise the central issues of our discipline. There are 4 nursing meta-paradigms. Those are person, environment, health, and nursing. Michel's uncertainty and illness theory has used these 4 meta-paradigms as a basis for the theory. The first meta-paradigm that this theory addresses is people. The people this theory addresses range from patients to family members to children to caregivers. Uncertainty cannot be limited to just the patient and involves the family as a whole. It has been reported that among patients recovering from illness or injury and among their care providers, use of a support system or network has been related to decreased levels of uncertainty. Next, we have environment. The level of uncertainty has been tied to the environment of the patient. F. Davis's study of uncertainty dates back to the 1960s. This research detailed the difference between clinical and functional uncertainty and tied the experiences to the delivery of care and the agenda of the healthcare providers. Third is health. Michel writes that uncertainty is not the total experience in acute and chronic illness, yet it is a constant occurrence from diagnosis to living with a long-term illness or condition. Last is the nurse. The knowledge of the level of uncertainty is observed and addressed by nurses. Nurses can alter the experiences of the patients that are experiencing these levels of uncertainty with understanding and comfort measures. As an ER nurse, the theory of uncertainty and illness fits well in my practice. People who come into the emergency room are most often seeking services for acute onset of an unknown illness. While everyone is not going to be diagnosed with a life-threatening illness, most come in with an attitude filled with uncertainty, stress, and vulnerability. The emergency room can be a catch-all for all diseases, life-threatening or not. The uncertainty of illness theory fits into the emergency room setting as evidenced by Michel, who states that the theory has its strongest support among persons who are experiencing the acute phase of illness or are in illnesses with a downward trajectory. The emergency room sees patients at their lowest points before the uncertainty can hopefully become more clear. After much research into the uncertainty and illness theory, there are 2 ways that this theory could influence my current practice. According to the development of the uncertainty communication checklist, a patient-centered approach to patient discharge from the emergency department by rising et al., clear communication with patients upon emergency department discharge is important for patient safety during the transition to outpatient care. Over 1/3 of patients are discharged from the ED with diagnostic uncertainty, yet there is no established approach to effective discharge communication. Establishing a better discharge instruction summary for the patients could help reduce fear of uncertainty. As a result of missing communication and uncertainty, the patients may not follow up with the appropriate entities. That is why better communication is important. Not only is it important to give clear instructions, secondly, it is also important to make sure the patients understand what these discharge instructions actually mean before letting them go. Transitions from emergency room care to outpatient can be a high-risk period for patient safety, and clear communication regarding discharge, diagnosis, prognosis, treatment plan, and expected course of illness is critical for safe discharge. Michel's theory of uncertainty seems to be mostly rooted towards palliative care and cancer patients, but I feel that this could also be rooted in emergency care.